My name is Jada. I'm going to go ahead and be your nurse for today. I'm just going to do your head to toe assessment. I'm just do some hand hygiene first. Perfect. And then, do you mind giving me your name and birth while I do this?
Kika Romero, 454.
Good. And your thing. Perfect. And do you know where you're at today?
The Sim Center.
Good. And then, what are you here for?
Head to toe assessment.
Good. And then also, what time of day is it?
Afternoonish.
Good. So you are alert and oriented times 4. You're well groomed and well cleaned. Your speech is clear and consistent with what I'm asking you. So your crude hearing is intact. Also, yeah, you're really conscious, which is fantastic. So now I'm gonna go ahead and assess your eyes and then your mouth. So what I'm going to do is I'm going to shine my pen light in your face and then go ahead and look over my shoulder when you do that, okay? So 1 and 2 and then 1 and 2. So for just these purposes that we have today, I didn't do with the lights off, but typically I would have had the lights off and that would have been better to assess your pupils. Also, I'm going to go ahead and push my pen light have my pen light go towards you, go ahead and track it, good, and then track it around as well. Okay, good. So your pupils are equal, round, reactive to light, both direct and accommodation, direct and consensual, bilat, as well as your pupils are going to be 3 millimeters, which is good and right within range. Also, I'm going to go ahead and check your mouth. So go ahead and open wide for me. Thank you. I'm just going to look inside and then let me see. And I'm just going to assess your tonsils as well as your. Yeah, okay. Perfect. So your tonsils are intact and present, as well as your uvula is rising onto midline. Also, your gums, your teeth, and your buccal mucosa were all present, and your gums and buccal mucosa were pink and intact, as well as your tongue on the ventral side was smooth and had the vein, and the dorsal side had the had the rough papillae, which is good. As well as your hard palate had the transverse rugae, and your soft palate had the it was pink and intact. And your lips are pink and intact as well. Perfect. So now I'm going to go ahead and assess your range of motion for your TMJ, which is temporal mandibular junction. So go ahead and open wide. Good. Now less wide. Now go ahead and out. Go. Now towards me. Perfect. And let go. And now I'm going to do some resistance. We'll try it again. Okay? So go ahead towards me. And towards me. And then out towards me. Good. And then I'm going to check also your cervical spine. So let me go ahead and palpate really quickly. Midline and good. And as well as your trachea is midline and centered. And your skin is consistent with ethnic background. So go ahead and rotate for me. Rotate. And then laterally bend, flex backwards, and flex forward. And that's good. So we're done with some resistance now. So go ahead and hyperextend, flex forward, lateral bend, and rotate, and rotate. Good. And now I'm going to check your shoulders as well. So go ahead and shoulder shrug for me. Good. Go ahead and pull out your arms. Now I'm going to go ahead and palpate. Are you feeling any tenderness?
No.
Alright, I'll palpate your legs as well. Any tenderness here?
No.
Perfect. Pedal pulses are there in times 2. And then radial pulses are also there times 2. And now I'm going to go ahead and have you extend again. Now go ahead and hyperextend. Go ahead and abduct. One more time, and circumflex. Good. So I'm going to do some of those with some resistance now. So go ahead and extend. Go ahead and hyperextend. Go ahead and abduct. Adduct. Good. And now I'm going to assess your elbows. So go ahead and flex inwards. Now extend out. Now I'm going to do it again. So flex in and extend out. Okay, good. Oh, I did it with resistance. I did both with resistance and without resistance. Perfect. Good. So now I'm going to do your wrists. So go ahead and invert, circumflex. Go ahead and plantar extend. Plantar flex, my bad, and then dorsal extend. And good. We're going to go through some of those with some resistance now. So go ahead and plantar flex, and dorsiflex. And then go ahead, abduct your fingers, abduct, and squeeze my hand. Good. So now that I just checked your cervical spine, I checked your TMJ, your shoulders, your elbows, your wrists, your fingers, and all had full 5 out of 5 range of motion. I'm gonna go ahead and get started with your cardiovascular system. And first, I'm gonna go ahead and inspect, and then I'm gonna go ahead and auscultate. So here we go on inspection and palpation of your chest. It's fine. Upon inspection of your chest, I'm not seeing any lumps, bumps, or anything else. And also, your skin is intact and consistent with cultural background. So now go ahead and auscultate your 5 precordial sites. Right here is going to be your aortic, which is at your second intercostal space, left sternal border, or right sternal border. Then here's your pulmonic, which is at your second intercostal space, right sternal border, left sternal border. My bad. Here is your Erb's point, which is at your third intercostal space, left sternal border. Here is your tricuspid at your fourth intercostal space, left sternal border. Go ahead and displace your breast for me. Thank you. And then here is your mitral point, or your apical pulse, which is at your fifth intercostal space, mid-clavicular line. Usually I would stay here for a full 60 seconds, but now I'm just doing 1 to 60 for demonstration purposes. And also usually I would go back with my bell and go mitral, then tricuspid, Erb's point, pulmonic, and then aortic, which is great. So upon my auscultation, I heard your S1 and S2 sounds, no adventitious heart sounds. Now I'm going to go ahead and go into your respiratory system. And, sorry. And I'm just going to go ahead and listen to your lungs, see how you're doing. But upon inspection again, skin is consistent with ethnic background, and I already palpated, and I still didn't find any lumps or bumps and things of that nature. So let me go ahead and listen to you. So this is 1, 2, 2, 3, 3, 4, 4, and 5. Typically I would listen for a full breath, but since this is a demonstration, we're not going to do that. I'm just going to go ahead right here and listen to your back, and your lungs in the back, right? First, I am going to go ahead and palpate. Do you feel any tenderness?
No.
Alright, and was there any tenderness on your back, on your front either?
No.
Okay, perfect. Now I'm going to go ahead and auscultate your lungs. So 1, 2, 2, 3, 3, 4, 4, and 5. Perfect. So again, listening to your breathing. Your breathing is euphonic and unlabored, as well as I was clear, there was no wheezing or crackles or anything like that present. I'm going to go ahead and get into your gastrointestinal system now though, and go ahead and lay back so I can expand your stomach. Go ahead and use up. Thank you. So I do have a ticklish patient today, so I'm going to be using her hand, as well as my hand to palpate. But first I'm going to go ahead and auscultate your gastrointestinal system. Yeah. Alright, and then first I'm going to be in your right lower quadrant and then go around. So here's your right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Perfect. So upon my auscultation, there was your vowel sounds were normal active ×4. Also upon looking and inspection, there is no lumps or bumps that I can see. Your abdomen is flat and with good contour, and your skin is consistent with ethnic background, which is great. So now we're going to go ahead and do the light palpation, which is going to be 1 to 2 centimeters. Oh, right upper quadrant, or right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. My apologies, my hands are cold. And now I'm going to go ahead and do deep palpation, which is like 3 to 5 centimeters. It's going to be a bit deeper. Oh, and then so deep, right upper lower quadrant, right lower upper quadrant, left upper quadrant, and left lower quadrant, which is great. So you can go ahead and put your shirt back down, thank you. And so when I was doing my palpation, the light palpation, your superficial musculature was intact and present. And then doing your deep palpation, as well as there was no lumps or bumps that we felt. Also upon deep palpation, there was no organoamygdales, and you're doing good. Also, again, there was no deeper lumps or things like that. You can go ahead and sit up for me. Or actually, no. Go ahead and have your legs down, and we're going to do range of motion for your hips. Go ahead and flex up with this leg. Now go ahead and internally rotate, externally rotate. Go ahead and extend down. Abduct towards me, adduct, and then we're gonna do that again with some resistance. So go ahead and flex up, internally rotate, externally rotate, go ahead and extend down, and we're gonna do abduct towards me and adduct towards me. Good. So now do the same thing with your other leg. Let's just slide my desk over here. Go ahead and flex, and then extend, abduct, adduct. Sorry, flex one more time, my apologies. And then go ahead and inwardly rotate, externally rotate. Good. And now we're gonna do that again with some resistance. So go ahead and put your leg back down. We're gonna have you flex it towards me. Now internally rotate, externally rotate, extend down, and then abduct, and then adduct. Good. So now we have you stand up or sit up, and I'll assess your knees. So go ahead and extend towards me, and then flex back. Good. So I'm gonna do it with some resistance. Go ahead and extend towards me, flex back. Good. And I will also assess your feet. So go ahead and plantar flex upward or downward, and then dorsiflex upwards, which is good. Do it against me with some resistance this time. So go ahead and down and then up. Good. Also go ahead and explain your evert, invert, circumduct. Good. And then for your toes, I want you to abduct and adduct and then clench. Good. So now I just checked your hips, your knees, your ankles, and your toes. I saw full 5 out of 5 A-ROM, which is good. And go ahead and stand up. I'm going to go ahead and have you lean your whole way forward. I'm going to check your spine. Good. Your spine is midline and intact, as well as your umbilicus was midline as well earlier. I just realized that. And go ahead. We're going to check your range of motion now for your spine. So we're going to hyperextend. Good. And lateral bend, and rotate. Good. Now I'm going to do that again. All right. Well, no, you don't do that again. So that was just full range of motion for your spine. And now I'm just assess your gait. So go ahead and walk a little bit for me. Stop there. And then now this time I want you to walk on your tiptoes. Good. And this time I want you to do on your heels. Good. And heel to toe. Wonderful, thank you. And you can go ahead and sit back down. You're all good. So your gait was precise and coordinated, so you did really good. And I think that's all that I need from you today. I'm going to go ahead and do some hand hygiene real quick again. And is there anything else that you need from me while I'm here? No? Good. And so here are your belongings. I brought them closer to you. This is your call light right here. Do you mind pressing the button for me? Perfect, thank you. So pressing that button, I'll go ahead and come and help you out. And that should be all. I'm going to go ahead and go, but have a wonderful day, and let me know if